Good morning, students. Let us talk on the anatomy of middle ear, which is a very important topic for undergraduates as well as postgraduates. So before I proceed with anatomy, you should know how the middle ear is developed. Let us know the development first, then let me tell you what middle ear cleft is. Then we'll know about the boundaries and contents of middle ear, the lining epithelium, blood supply, lymphatic supply, and nerves. Students, let me tell you, whenever you are asked to tell something about anatomy of any part in that matter, this is how you have to start with. So how it is developed embryologically, and then you have to tell the lining epithelium, the boundaries, and not to forget about the blood supply, lymphatic supply, and nerve supply. You have to say everything. So how is your middle ear developed? During early stages of development, a series of visceral arches, known as branchial arches, appear on the lateral aspect of head. The mesenchymal arches form ridges in the overlying ectoderm and corresponding projections in the endoderm of the pharynx occur. The ridges become separated from one another by a series of furrows. Those are the furrows there. And the ectodermal furrows form visceral clefts. These are the visceral clefts. The endodermal furrows form the pharyngeal pouch. This is the pharyngeal pouch. So you have an arch, you have a cleft here, and then this is the pouch which is formed. So how is your tympanic membrane developed? So this is the only structure in the ear which is developed from all the three germ layers. That is, it is developed from epithelial, it is developed from, I mean to say it is developed from ectoderm, mesoderm, as well as from the endoderm. Tympanic membrane, as you all know, has three layers: an outer epithelial layer, which is developed from ectoderm, a middle fibrous layer, which is developed from mesoderm between the first visceral cleft and the tubotympanic recess, and it has an inner mucosal layer from a part of recess, that is tubotympanic recess. So eustachian tube and the tympanic cavity, these are developed from the endoderm of the tubotympanic recess formed by the dorsal part of the first branchial pouch, receiving a contribution from the dorsal part of the second pouch. That's the tubotympanic recess. Now, how is your ossicles and muscles developed? The first arch, which is also called the mandibular arch, will give rise to your malleus and incus and tensor tympani muscles. So your stapes and stapedius muscle is developed from your second arch, which is also called the hyoid arch. Now your foot plate of stapes and annular ligament is developed from your otic capsule. Otic capsule development starts at 3rd week and ends at 13th week. So how is your otic capsule developed? It is developed from mesenchyme surrounding the derivatives of the otocyst that becomes dense and chondrified to form otic capsule. The temporal bone actually is formed by 4 parts: tympanic ring, the squama, the styloid process, and petromastoid. So this is the tympanic ring. That's the squamous part. This is the petromastoid part. That's the styloid process. So your mastoid process is not present at birth. It is developed later. The mastoid portion of the temporal bone is at birth flat, and stylomastoid foramen lies immediately behind the tympanic ring. As air cells develop, the lateral part of the mastoid portion grows downwards and forwards to form the mastoid process. Hence, the stylomastoid foramen comes to lie on the undersurface of the bone as the child grows. Middle ear cleft. Now let us know what is middle ear cleft. You have to know the difference between middle ear cleft and middle ear proper or middle ear cavity. Middle ear cavity is also called tympanic cavity, whereas middle ear cleft includes tympanic cavity, adductus ad antrum, mastoid, air cell system, along with your eustachian tube. So your tympanic cavity has epitympanum, mesotympanum, and hypotympanum. So how is your tympanic cavity divided into three compartments? It is actually divided by your malleolar folds. Epitympanum is the part lying above the level of short process of malleus, medial to the bone, formed by horizontal part of the squamous. Mesotympanum is that portion of the middle ear which is lying medial to tympanic membrane, whereas your hypotympanum is that part of the middle ear which lies below the tympanic membrane and medial to tympanic plate. So what are the other components of middle ear cleft? It includes addutus and antrum, mastoid air cells, other mastoid air cells, and your eustachian tube. So these are the three compartments of your middle ear. This is your epitympanum, this is your mesotympanum, and this is your hypotympanum. According to the dimensions, if you see, epitympanum is the largest. It is around 6 millimeters. Mesotympanum, as in this picture, it looks very big, but it is the smallest portion of the tympanic cavity. It is just 2 millimeters, whereas your hypotympanum is around 4 millimeters. So this is the tympanic membrane. This is lateral and this is medial portion. So tympanic membrane is divided into two parts, pars flaccida and this is pars tensa. This is your outer attic wall, which is also called scutum. So coming to the boundaries of tympanic cavity. It is actually compared to a matchbox, looks like a matchbox with roof and floor and 4 walls. It's actually an irregular air-filled space within the temporal bone. For descriptive purpose, may be thought of as a box with 4 walls, a roof and a floor. Okay, that's the roof. This is the floor. This is anterior wall. This is posterior wall. That's the medial wall. And what you see laterally, which is not visible here, is your tympanic membrane. Now coming to the lateral wall. Lateral wall is formed partly by bony part and partly it is membranous. Tympanic membrane forms the central portion of the lateral wall. Above and below there is a bone forming outer lateral wall, and then there is epitympanum and hypotympanum. So the tympanic membrane is thin and it is semi-transparent. It's pearly white in color and it's placed at an angle of 55 degrees to the floor of the meatus. The longest diameter is 9 to 10 millimeters from postero-superior to antero-inferior, while perpendicularly it is 8 to 9 millimeters. It has 3 layers, outer epithelial, middle fibrous, and inner mucosal layer. It's divided into pars tensa, pars flaccida, and it has outer attic wall, which is also called scutum. So you can see This is pars flaccida. This is pars tensa. These are the two parts of tympanic membrane. Pars flaccida is also called as shrapnel's membrane. You can see these are the two malleolar folds which divide your tympanic membrane into two parts, pars flaccida and pars tensa. So you have a cone of light in the anteroinferior quadrant, and then this is the peripheral condensed portion of the tympanic membrane, which is called the annulus, which sits into the bony sulcus. If you can see the tympanic membrane, it's actually obliquely set like this. So you have an incudostepedial joint, which can be visible sometimes if the tympanic membrane is very thin. Then that's the prominent lateral process of malleus. This is the handle of malleus. So three openings are present in the bone of the medial surface of the lateral wall of tympanic membrane. Posterior canaliculus for chorda tympani and stylomastoid artery. Petrotympanic fissure. It's also called Gleiserian fissure, which opens anteriorly and it receives anterior malleolar ligament and transmits anterior tympanic branch of maxillary artery. Then you have anterior canaliculus, which is called canal of Hooker, placed at medial end of petrotympanic fissure, wherein your chorda tympani enters. Medial wall separates tympanic cavity from the inner ear. So you have a promontory, which is a rounded elevation occupying much of central portion of medial wall, formed by the first turn, otherwise called the basal turn of cochlea. Then you have fenestra vestibuli. It's also called oval window. It's a kidney-shaped opening behind and above the promontory, closed by base or the footplate of stapes and its surrounding annular ligament. The size of the footplate is 3.25 millimeters long and 1.75 millimeters wide. In the medial wall, just above the oval window, is the horizontal portion of facial nerve lying in its bony fallopian canal. The ampullary end of horizontal semicircular canal lies above the facial canal. This is the promontory. This is the round window niche. This is your oval window. This is canal for tensor tympani, and this is a bony projection, a prominent bony projection in the medial wall, which is called processus cochleariformis, a very important landmark for the first genu of facial nerve. So this is your facial nerve. These are the mastoid cells, different mastoid cells. This is the second genu here. That's the vertical portion. That's the horizontal portion of your facial nerve. And this is your mastoid antrum. So this is your lateral semicircular canal here. So in the medial wall, you have another important opening, which is called fenestra cochleae. It's closed by secondary tympanic membrane. And it lies below and behind fenestra vestibuli, from which it is separated by a posterior extension of the promontory called the subiculum. Now, what is ponticulus? It's a bony specule which leaves the promontory above the subiculum and turns to pyramid on the posterior wall of the cavity. What is processus cochleariformis? It's a very important landmark. The septum between the tubal orifice and canal for tensor tympani is prolonged backwards along the middle of the cavity as a shell of bone called processus cochleariformis. Now, why is this important? It's a very important landmark as it corresponds to the first facial nerve. Second thing, it's very important because there is the tensor tympani muscle which hooks around the tensor tympani, and as it arises from the bony portion of the eustachian tube, It will hook around the processus cochleariformis and gets attached to the neck of malleus. Coming to the anterior wall. Anterior wall is actually very narrow as medial and lateral wall converge on it. The lower portion is larger and it consists of a thin plate of bone covering the carotid artery. The upper smaller part has two parallel tunnels. The lower tunnel leads into the bony portion of the eustachian tube. The upper tunnel contains the tensor tympani muscle. See, this is the upper tunnel which contains the tensor tympani muscle, and then you have the carotid artery, canal for carotid. This is the eustachian tube. This is the anterior wall. Coming to the posterior wall. We have divided or compared the middle ear to a box just for descriptive purpose. But actually, if you see anatomy in a human body, when we actually do examination of middle ear by otoendoscopy, or when we see through a perforation, or when you do a cadaver dissection, it is actually continuous. It's not like four walls. So it is very difficult to differentiate the continuity. The medial wall and posterior wall continues without any deviation. I mean, there is no exact demarcation between the medial and the posterior wall. So posterior wall is wider above than below, and it has in its upper part the adytus which opens into mastodantrum. Below is fossa incudus, which houses short process of incus. Below fossa incudus and medial to opening of cauda tympani nerve is the pyramid containing stapedius muscle. Coming to facial recess in the posterior wall, this is bounded medially by the facial nerve, laterally by the tympanic annulus, but running through the wall between the two is cauda tympani. There's another important deep recess in the posterior wall, just below the facial recess, which is called sinus tympani or the pyramidal recess. It's a triangular recessed area that starts above at the oval window niche. It occupies a groove deep to the descending portion of the facial nerve and to the pyramid, and passes behind the round window niche to the hypotympanum. Coming to the floor. Floor is actually formed by a thin plate of the bone which separates the tympanic cavity from the tube of jugular bulb. The roof is formed by tegment tympani. Again, it's a thin plate of bone which separates your tympanic cavity from the middle cranius fossa, which is formed by a part of petrous and part by squamous portion. Now, what are the important contents of middle ear? Apart from your ossicles, muscles, and the nerves, the most important content of middle ear is air. So your middle ear, as you all know, is ventilated through the eustachian tube. For the normal physiology of hearing, the mere presence of air is very much essential. So you have three important ossicles. They're called malleus, incus, and stapes. Two important muscles, stapedius and tensor tympani, and two important nerves. Apart from your facial nerve, you have cauda tympani and then tympanic plexus. You can see the three ossicles over here. Stapes, incus, and malleus. Okay. So adytus and antrum. This leads backwards from the upper attic space of epitympanum into the mastodantrum. So adytus and antrum is actually present in the posterior wall of the middle ear, which connects your tympanic cavity to the mastoid. Medial wall and the floor is formed by bony prominence of the lateral semicircular canal. The floor is formed by short process of incus, and inferiorly by the facial nerve. So this is your hiatus and antrum. Hiatus means an opening. So this is the antrum. So this is an opening which connects your tympanic cavity. This is the middle ear cavity. This is the eustachian tube. So you can see that this is the opening in the posterior wall connecting your tympanic cavity to that of the mastoid antrum. What exactly is antrum? Antrum is an air-filled sinus within the mastoid part of the temporal bone. The roof is actually formed by tegmenantri. The lateral wall corresponds to McEwen's triangle, which is defined by the supramastoid crest, a posterior prolongation of upper border of root of zygoma, vertical tangential line passing through the posterior margin of external meatus, and finally by the posterior superior margin of the external meatus itself. So this is a very important landmark to approach the mastoid antrum when you're doing mastoidectomy. The floor is related to your digastric muscle laterally and sigmoid sinus medially. So what are the different types of mastoid air cells? Mastoid air cells may be classified as cellular, diploic, and sclerotic. 80% of the mastoids are pneumatized, 20% are diploic or sclerotic. The following groups of cells may be present. There can be tip cells. These are the tip cells. These are the perisinus cells. These are the sinodural angle cells. You have perilabyrinthine. That's around the semicircular canal or labyrinth. Then you have superficial or dural cells, that is very close to tegmen plate. Then perifacial, that's around the, these are the perifacial cells, that's around the facial nerve. So if the temporal bone is well pneumatized, it's called cellular bone. If the temporal bone is partly pneumatized and partly sclerotic, it's called diploic. And if there are no mastoid air cells at all, except antrum, it is sclerotic. So what is the lining epithelium of the eustachian tube and the tympanic cavity? The lining epithelium of the eustachian tube is pseudostratified ciliated columnar epithelium in the cartilaginous part and its columnar epithelium in the bony part. So what is the significance of this? So this cilia will help in cleansing the normal secretions which are produced in the middle ear, and it will be drained through the eustachian tube into the nasopharynx. So it helps in drainage as well as ventilation. Eustachian tube plays a very important role in ventilating the middle ear also. So your tympanic cavity proper, you have ciliated columnar epithelium in the anterior and inferior portion of the mesotympanum and the protympanum portion. That is, protympanum is that portion of the middle ear wherein there is opening of the eustachian tube. So you have cuboidal in the posterior part of the mesotympanum, and then in the epitympanum and the mastoid air cells, you have flat, non-ciliated or single pavement epithelium. Now coming to the eustachian tube. It's very important to know the anatomy of eustachian tube whenever you're discussing about middle ear, because if there is eustachian tube dysfunction, the normal physiology of hearing is impaired. So for normal hearing or the normal functions of the middle ear, your eustachian tube function should be normal. So coming to the anatomy of eustachian tube, it's also called auditory tube. It's about 66 millimeters long. It passes downwards, forwards, and medially. It has two parts, bony and cartilaginous. Bony part is the lateral portion, which is actually connected to your anterior wall of the middle ear. It's about 12 millimeters. And you have a narrowest portion, which is called the isthmus, which connects your bony part with the cartilaginous part. This isthmus is related medially to carotid artery and superiorly to tensor tympani muscle. The cartilaginous part is around 24 millimeters. Then posterior medial wall is actually cartilage completely. Then anterolateral wall, there is partly cartilaginous and partly fibrous tissue present. So what are the muscles attached or related to your eustachian tube? Tensor tympani, tensor pallati muscle, levator pallati muscle, and salpingopharyngeus muscle. So all these muscles are very important, and there is something called Ostman's pad of fat around the eustachian tube, which will actually act as a cushioning agent. That Ostman pad of fat, if at all is deficient, it will lead into pactylus eustachian tube, wherein the patient will have the complaints of autophony. The patient says that he can hear his own voice. So if you can see, this is the bony portion of the eustachian tube. This is the isthmus, which is the narrowest portion of the eustachian tube. And this is the cartilaginous portion of the eustachian tube. The cartilaginous portion is called the pharyngeal end, whereas that portion of the eustachian tube which will open into the anterior wall of the middle ear is called the tympanic end. So the pharyngeal end will open into the lateral wall of the nasopharynx. Now coming to the blood supply of the middle ear. So anterior tympanic branch is a branch of maxillary artery. Stylomastoid artery is a branch of posterior auricular artery. Mastoid artery is a branch of stylomastoid artery. Petrosal artery is a branch of middle meningeal artery. Superior tympanic branch is a branch of middle meningeal artery. Inferior tympanic is a branch of ascending pharyngeal. So these are some of the branches, and the parent artery is from maxillary artery, and then posterior auricular, stylomastoid. If you see, most of it is from the external carotid artery, except for your middle meningeal. So branch from the artery of pterygoid canal, tympanic branches of internal carotid, lymphatics drain to retropharyngeal and parotid nodes. So blood supply of middle ear has to be known. Coming to the facial nerve. Facial nerve is a mixed nerve. It has a sensory component. It has a motor component and a special sensory function. So facial nerve actually has an intracranial course, and then intratemporal course, and then extratemporal course. So intratemporal course is something which is very important for us to know as an ENT surgeons, because in most common ear pathology, what we come across is otitis media, for which mastodectomy is the surgery commonly done. So in order to know the exact landmarks, or if you want to do mastodectomy, if you don't know the anatomy of facial nerve, there are high chances that you injure it. So coming to the anatomy, see, in the intertemporal, it has a labyrinthine portion and it has a horizontal portion, it has a vertical portion, and it exits out through the stylomastoid foramen and gives off 5 branches which are called pes anserinus. So facial nerve anatomy itself is a separate class. I'm just showing you important uh, part which will form the one of the content of your middle ear. So if at all I start talking of facial nerve, the lecture will not be complete. So I would like to take facial nerve anatomy as a different class. So if you can see, this is the nerve, okay, horizontal portion. This is the second genu, that will be the first genu. This will be the vertical portion, and then it exits out through the stylomastoid foramen and gives off branches. It's called pes anserinus. So I'll talk about the anatomy of facial nerve in another class. So you should know about the tympanic plexus also. Tympanic plexus is formed over the promontory, and it is formed by the tympanic branch of the glossopharyngeal nerve and the lesser petrosal nerve. So this tympanic plexus, why should you know about the tympanic plexus is, since it has secretomotor or parasympathetic postganglionic fibers to the parotid gland through the otic capsule that will actually come from your lesser petrosal nerve and the auricular nerve, auriculotemporal nerve. Suppose if the patient is having Frey syndrome, what is Frey syndrome is following superficial parotidectomy, what exactly happens is, if at all the nerve endings are exposed, and if there is abnormal regeneration or synkinesis, what exactly happens is, whenever the patient is swallowing or eating or chewing, there will be sweating. So for that, if at all we do, and that will cause actually excessive parotid secretions and excessive salivation. So if at all we do glossopharyngeal neurectomy in such cases, you should know where exactly the tympanic plexus is situated. So it's exactly over the promontory, that is in the medial wall. So that's why you should know the anatomy. So that will be very helpful if at all the patient is having Frey syndrome, which is one of the complications that can happen following superficial parotidectomy. So thank you for now. Now, let me tell you what anatomy has been discussed today is just in brief for the undergraduates. And anatomy of facial nerve cannot be combined with this as such, because it's a very important topic. It's not possible to complete in one class. Let me take an anatomy of facial nerve in another lecture. Thank you.